Okay, in this section we're going to talk about lung cancer or cancers associated with the respiratory system. Uh, you'll note in your on your PowerPoint that lip cancers are a common form of cancer for the respiratory system. Those are usually exophytic, meaning they're on the outside of the lip. Um, they happen more commonly in men, most likely probably due to tobacco chewing. About 2,000 cases a year, again, due to exposure from sun and exposure by way of chewing tobacco, possibly in people who are immunocompromised, especially the elderly. Um, regarding laryngeal cancer is also secondary to tobacco. This is carcinoma of the vocal cords, a squamous cell carcinoma, the symptom of which most commonly is hoarseness. But the one we want to talk about mostly here is lung cancer. Um, Lung cancer is the most common cancer death, and it is the most common. It's the cause of most cancer deaths in the United. I'm sorry, most deaths in the United States. 29% of all deaths in the United States are due to um, lung cancer. And most of that is due to smoking. Bronchogenic cancers are mostly epithelial tissue. There are other types of cancers that affect the respiratory system, but we're talking mostly here of bronchogenic cancers. Smoking increases 20 times greater risk of developing cancer than non-smokers. Mostly these are due to smoking. Secondary smoke would be the second category, so people who don't smoke but are exposed to secondary smoke, either in the environment or certainly in the home or enclosed areas. And then the third would be exposures due to the environment or occupational carcinogens, breathing in those. When we talk about those bronchogenic cancers, we're talking about four main types. The non-small cell, and if you look on your notes, it says non-small cell lung cancer includes, and that should be the squamous cell, adenocarcinoma, and the large cell. All those are non-small cell. Squamous, and by the way, so 80% of the cancers of bronchogenic lung cancers are non-small cell. Squamous cell carcinoma is usually hilar or centrally located, producing a non-productive cough and hemoptysis. These are very slow growing. They don't often metastasize to other areas. But they do trigger, because they are obstructive, they do trigger pneumonia and atelectasis or lung collapse. Adenocarcinoma opposite, it's oftentimes in the periphery, peripherally located, so that would cause some different symptoms. These are most often not due, or I should say the lowest correlation to smoking. Most often these are due to environmental toxins and occupational carcinogens exposure. These are often asymptomatic and they grow very slowly. They're often found on a chest x-ray in the elderly. Again, these are peripheral, whereas the squamous are more hilar, therefore causing obstruction. The large cell carcinoma produces, these cells are undifferentiated cells. And so they don't look like a lung cell at all. The biggest issue with these is they cause a distortion. They're a large cell and they'll produce large tumors, and they cause a distortion of the trachea and that causes issues with inflammation and with aspiration. And then there's the small cell carcinomas. Small cell carcinomas, about 20% of all the bronchogenic cancers are small cell carcinoma. Again, this is especially smokers. Small cell carcinoma, at one time known as oat cell carcinoma, because that's what they look like. They're very small little oats. The issue with these are they have probably the worst prognosis. They grow very rapidly. As a matter of fact, they double. I think in like 30 in a month, they'll double. Early metastasis and they're widespread throughout the lungs. They're so they are deadly. About 14% of people with the diagnosis of a small cell carcinoma are alive within 2 years. So high death rate with these. In addition to the fact that they cause widespread loss of lung tissue, these are the ones that cause the ectopic hormone release. Remember when we talked about paraneoplastic syndrome, and one example of that would be production of ADH by these particular types of cancers. So you develop the syndrome SIADH, where a person holds on to ADH and therefore holds on to water, common in this type of cancer. That is all I want to say about cancer. So that's it for today. Thanks.